Heat or ice? Which is better for low back pain? That's one of the most common questions that I get from patients. And the answer that I routinely give is that it really doesn't matter. Use whichever one feels best for you. But if you want my recommendation, use heat. Now, the conventional wisdom for ice versus heat is to use ice for the first 24 to 48 hours and then use heat after that. But that's largely based on thought processes for more superficial joints like knees or ankles, where the tissues are really local to the surface. It's also based on if you have an acute injury such as an ankle sprain, where you roll your ankle, you get bruising and swelling. The benefits of ice in that situation are that it causes vasoconstriction, or it causes your blood vessels to constrict. If you have torn blood vessels, that decreases how much blood you lose, and furthermore, it decreases the metabolism of your tissues. If they're not getting blood flow and not getting nutrients and oxygen, it decreases their energy demands so that you limit cell death while your blood vessels are healing. But for something like a back injury that's typically a little bit deeper tissue, superficial ice or heat really aren't going to have those effects. The maximum penetration of superficial ice or heat is about 1/2 centimeter or about 1/5 of an inch. In the lower back area, that's often not deep enough even to get through the skin layer, but certainly not down to the deeper layers of muscle, and most certainly not down to the actual spine or discs itself. So the effect of ice and heat in your lower back have less to do with actual tissue healing and more to do with the neurological signaling of pain and the processing of pain in your brain. Both ice and heat activate thermal receptors. The collective group is known as transient receptor potential membrane channels, or TRP receptors for short. Heat activates the TRPV1 receptor, and ice or cold activates the TRPM8 receptor. Now, ice causes a slowing down of nerve conduction, so it basically decreases how fast the signal from your tissues gets up to your brain. Heat, on the other hand, activates the TRPV1 receptor. That sends a signal along your spinal cord along the spinothalamic tract, which carries information both about temperature as well as nociception, or painful sensations. When that signal hits your brain, it triggers your brain to release opioid-like chemicals such as endorphins. Those both block further signals from getting up to your brain, as well as makes your brain not care about those signals so much. So it's not perceived as much of a threat. What this can do is help decrease muscle spasm, which can further trigger pain. So really, using heat breaks up a pain spasm cycle with the muscles in your back and helps decrease the transition of acute pain to chronic pain. It also decreases pain enough that you can move and be more active, which have been shown to decrease back pain over the long term. So how long should you use ice or heat? Well, again, conventional wisdom says about 15 to 20 minutes. But according to research, that's probably massively underdosing. Most of the research on superficial heat studies low-level continuous heat, which actually has been shown to be very effective for lower back pain. It's been shown to be more effective than both ibuprofen and acetaminophen in certain studies. It's also been shown to increase range of motion in the lower back, which again, if you can move better, you can do things over the longer term to help decrease your back pain. Furthermore, the combination of low-level prolonged heat combined with exercise has been shown to be more effective than either one of those alone. Now, the low-level continuous heat wrap used in most of the research studies is the Thermacare wrap, and this isn't a paid product placement. That's just what they used in the studies. It should be noted that some of those studies were funded by Procter & Gamble, the company that originally produced Thermacare. It's since been sold to other companies, but there is a small risk of bias when the company that produces the product funds the research. But there have been enough research studies showing the effects of low-level continuous heat, and the side effects are fairly minimal. For most people, the side effects are some rash or skin pinkness. You do have to be a little bit careful with any type of thermal product or heat product that you don't cause burns, especially if you have decreased sensation in your skin. Now, if you don't want to use Thermacare wraps because they're disposable, you have to keep buying them over and over and over, using a wearable heating blanket can be helpful. This is one from Bob and Brad. They did send this one to me for free to try out, but I do like it because it covers a large surface area. It ties around so you can actually get a little bit of compression, much like a disposable heat wrap. And you can wear it for up to 2 hours before it shuts off. And then you can just reset it several times if you want to have that 8-hour continuous period. The downside is that you do have to be plugged in to use this. So this might be good for someone who works in an office where you have easy access to a plug and you can sit in your office chair with the heat for a prolonged period of time. If you're someone who's more on the go and you have more of an active physical job and you can't just sit down, then you may be better off with a Thermacare type of patch that you can take on the go and don't have to plug in. But this is also good if you're just sitting relaxing on the couch at night. Now, what about the various heating and cooling creams and gels and rubs? Which of those work best? Well, again, they're all really just symptomatic relief, so use whichever one works best for you as long as you're not allergic to it. The more heating ones tend to have an active ingredient like capsaicin, which activates the TRPV1 receptor, or more of the cooling ones like BioFreeze that have menthol as an active ingredient tend to activate the TRPM8 receptor. But again, they're more symptomatic relief to allow you to be active and move and do things that will help decrease your pain over the long term, help you return to a more active lifestyle, and help prevent the neurological transition from acute pain to chronic pain. Now, neither ice nor heat will address the underlying root cause that caused the pain in the first place. Again, their penetration depths are very superficial, so they're probably not actually causing any tissue healing. Furthermore, unless you've had a traumatic back injury, for example, from a car accident, most back injuries are due to cumulative microtrauma over time, meaning not one big injury, but little tiny injuries that you sustain by doing repeated or sustained postures. And if you don't address those things, then neither ice nor heat will help over the long term because you're just going to keep re-aggravating your back. So if you'd like to find the root cause of your lower back pain and you're in the St. Louis area, we'd be happy to help you out here at More for Life. And if you're watching this from somewhere else, but you need more tips to get to the root causes of your lower back pain, check out this lower back pain relief playlist right over here. But before you go check that out, if you found this video helpful, make sure to give it a like and subscribe to our channel so you can get notified of our future videos. Thanks for watching, and I'll see you in the next video.